Assalamu alaikum, Dr. Arshad Mood here. In this video, we are going to discuss the common skin manifestation of diseases in pediatric age group. So, first thing is that how we describe the rash in child and what is a rash. Rash is basically any skin manifestation that can be a change in color of skin or texture of skin. So, rash is nothing but a change in color of skin or texture of skin. So, how you describe a rash in children during examination or during your ward round. So important things that should be kept in mind before describing rash are: one is the color of rash. It can be erythematous, that is red. Most common rashes are erythematous. It can be black in color, blue in color, or other colors can also be seen. Second is the distribution, that it is localized or generalized. Some rashes can affect only a part of body, like Botwine stain affects the one side of face, while other rashes can be generalized, like rash of measles is seen throughout the body. So rashes can be localized or generalized. Third is symmetry. The rash is symmetrical or asymmetrical. If it is occurring on the one side of body or some part of body, then asymmetrical rash, like rash of shingles is of dermatome and affects one side of dermatome, so it is a asymmetrical. While the rash of HSP, that is Hinox-Charlian purpura, is symmetrical rash, involve the both side. So by keeping these characteristics, we describe the rash: the color of rash, the distribution of rash, the symmetry of rash, and there are other features that we will describe during our video. So our first case is of measles. The characteristic of measles rash are that it is maculopapular rash, it is confluent rash, that the maculopapular lesion are very close to each other. As you can see in this video, the patient is having maculopapular rash and that is confluent, and confluence is more predominantly seen on the chest area. Again, a case of measles lesion with the maculopapular lesions and that are confluent on the back of child. This picture is showing the multiple features of measles that include the coryza, cough, and conjunctivitis. So in this video you can appreciate the conjunctivitis as well as coryza as well as the rash of measles. This is again a very important feature of measles, that is complex spot that are seen before the appearance of these measles rash on the buccal mucosa, and these are seen here in this picture. This is a case of mumps with the parotitis seen with absence of the angle of mandible properly not visualized on the left side. So it is a case of mumps. This is case of rubella, that is also called as German measles, with a rash that is again maculopapular, or it is not confluent, and it is of color of this rash is fade as compared to that of measles. So in persons with the white complexion or fair complexion, this rash will be visualized, while those with dark complexion, it is difficult to visualize the rash of German measles or rubella. Again, a rash of German measles, it is maculopapular, however it is a fade type of rash. This is a case of again a case of German measles or rubella with posterior cervical lymphadenopathy, that is characteristic feature of rubella. Now these are the vesicular lesion, and these are typical feature of varicella, that is chickenpox. So vesicular lesion are typical feature of chickenpox, and these are discrete lesions involve all the body. And in this picture you can appreciate that vesicular lesion as well as macular and papular lesion. So all the stages of lesion will be seen in this case. Again, a case of chickenpox or varicella with vesicular as well as maculopapular lesions, or these lesions are very discrete, that is characteristic of varicella. Now this is characteristic lesion of parvovirus leading to erythema infectiosum and the slap cheek appearance of the child. This is against the slap cheek appearance of child as well as the rash on the body. Now the characteristic of this erythema infectiosum rash is that it leads to a reticular or network like pattern as seen in this picture. So this is case of the case of erythema infectiosum with net like appearance of the rash on the body. It is seen on the body as a net like rash. This is strawberry tongue, and it is red strawberry tongue. It can be seen in multiple conditions, like in scarlet fever, like in Kawasaki disease. So this is rash typical of scarlet fever. That is like sunburn rash, and if you feel it, it is like just like you feel at sandpaper. Feelings comes when you touch it. So this is again characteristic feature of scarlet fever with circumoral pallor is seen. The area of face other is red, but the circumoral area is pale. These are lines seen on the flexure area. This is the cubital fossa, showing some horizontal lines. These are posterior lines, and these are seen in scarlet fever. Again, strawberry tongue, typical for scarlet fever, as well as seen in the case of Kawasaki disease. Again, feature of scarlet fever with the bilateral pharyngitis, tonsillitis. This is again a rash of scarlet fever on the body, that is sandpaper rash, and it is also a faint rash. Again, a case of scarlet fever with body rash. This is case of dengue fever with a rash seen. All the patients with dengue do not get rash, but you can appreciate in some patient with dengue rash. So it is seen as in this picture. So the characteristic of Kawasaki are summed up in this picture in the form of conjunctivitis, that is non-purulent. Again, erythema of the oral cavity, strawberry tongue, cervical phenopathy, that is unilateral, and the swelling of hands and feet, along with loss of denudation of skin and the edema. So these are characteristic features are seen here in this picture. This is a rash of Henoch-Schönlein purpura. The characteristic of Henoch-Schönlein purpura rash are that it is symmetrical. It involves the pressure points like on buttock area. Like if you are wearing socks, then the pressure area of socks will be affected, and it usually involves the flexure surfaces. So these are the characteristic, and its rash is palpable and non-blanchable rash. The rash of measles is non-palpable and it is blanchable, while the rash of HSP is palpable and non-blanchable. Because if vasculitis or blood is in skin, it will not be blanchable. Again, a rash of HSP with typical distribution in pressure point areas. This is case of urticaria with wheals are seen here. Wheals and hives are seen here. Again, a case of urticaria. Again, a case of urticaria with wheals and hives. The characteristic of these urticaria is that these lesions migrate. Once you give them steroid or antihistamine, then it typically completely disappear, and then they again, when the effect of those drugs are gone, they again reappear, and they are very pruritic. Again, a case of urticaria. Now this is a case of erythema multiforme. This seems like urticaria, but the differentiating point again is that if you give antihistamine or steroid, it will not migrate, it will persist, and it is having typical target appearance with central pallor. Again, a case of erythema multiforme with central pallor. This is a case of severe case of 10, that is toxic epidermal necrolysis with involvement of mucosa and sloughing of all the skin is seen. Now this picture is showing the differentiation between the SJS, that is Stevens-Johnson syndrome, SJS10 overlap, and the 10. It depends basically upon the involvement of body surface area. If it is less than 10%, then it is SJS. If it is 10 to 30%, then it is overlap of SJS and 10, and if it is more than 30%, then it is 10. In both 10 and SJS, mucous membranes are involved, while in erythema multiforme, mucous membranes are not involved, only skin is involved. Again, a case of Stevens-Johnson syndrome with involvement of mucous membrane and the skin. You can see sloughing of skin here. Now this case is of erythema marginatum of rheumatic fever. Here serpentine lesions, snake-like lesions are seen. As you can see, the border of snake-like borders. Again, a case of erythema marginatum with serpentine border-like lesions are seen. These are non-pruritic and mostly seen in the trunk areas. Again, a case of erythema marginatum with serpentine-like lesions and seen on the trunk in the chest area. It's a case of Lyme disease with erythema migrans, and it is a target appearance with central red area surrounded by a hollow, and then again a erythematous ring is seen. Again, a case of chronic erythema migrans of Lyme disease. It is a case of tinea corporis with inflamed elevated margin, and also the scaly lesions are seen here. Again, a case of erythema tinea corporis, circular lesion with elevated border and scales are seen throughout the lesion. Again, a case of tinea corporis. It is a case of cutaneous larva migrans, and the tract of larva is seen here. Again, a case of cutaneous larva migrans. Now these are the three pictures which differentiated between the petechiae purpura and ecchymosis. all these three conditions are skin bleeds, but depending upon the size, we differentiate into petechiae, purpura, and ecchymosis. If size is 1 to 2 millimeter, then these are petechiae. If size is more than 3 millimeter, then these are purpura, and if its size is more than 1 to 2 centimeter, then these are ecchymosis. So less than 2 millimeter petechiae, 2 to 10 millimeter purpura, and more than 10 millimeter is ecchymosis. This is a case of shingles or herpes zoster with grouped lesion and dermatomal distribution. You can see only one side of chest is involved here. Again, a case of herpes zoster with involvement of one side of ophthalmic division of trigeminal nerve. Again, a case of herpes zoster and shingles. It is a case of herpes labialis with grouped lesion seen on the upper lip. Again, a case of herpes labialis with grouped lesion seen on the lower lip margin. It is a case of dermatitis herpetiformis in patients with eczema. If herpes occurs, then its severity is increased, and there are severe form and multiple and aggressive lesions are seen. So it is a case of dermatitis herpetiformis. It is a severe form of herpes which is seen in atopic patients. Now this is scabies bug, the most notorious and most common dermatological manifestation that you see in OPD practice in pediatric age group. These are skin manifestation of scabies with lesions seen on the palm and in the fingers and interdigital areas. Again, a case of scabies with the lesions seen on the palm of the patient. These are the frequently affected site in case of scabies: the flexure area of the knee, the inguinal area, the abdomen, the chest, nipple area, and even scalp is affected in the neonates. Again, as burrows of scabies are seen here. So again, a case of scabies with involvement of the hand in the interdigital areas are seen here. This is a case of scalp cradle cap and seborrheic dermatitis. Case of celiac disease with the skin lesion that is called as skin manifestation of the celiac disease. It is very pruritic and painful condition. So it is seen in patient with gluten sensitive enteropathy. It is a case of vitiligo with depigmented patches seen. Also depigmented hairs are seen here.